issue of establishing a statewide research program, and you addressed some of that in your response to Assemblyman Godfrey. But I'm curious as to why we think, at this point in the history of medical marijuana, we need to do a research program of any kind when 21 other states have been doing it. In fact, there are other nations, there are other countries besides the United States. There's been extensive research in Israel, there's been extensive research in Canada, extensive research in Ireland. So we don't really need to research the value of medical marijuana as a treatment alternative for people with particular conditions. What we need to do is establish a regulatory model in New York State that will allow for the creation of a legal grow industry so that we have access to a product that is clean, that is multivaried, because as we know, not everybody smokes medical marijuana. In fact, most people don't. So we need to be moving in that direction, not starting as if no one has ever done this before, reinventing the wheel. We are on the verge of being, I think we actually are now, the only state north of Delaware on the East Coast that doesn't have a medical marijuana statute. So if you're interested in research, perhaps you just, pull out the old Easy Pass and go to Jersey or go to Connecticut or go to Massachusetts or fly to Colorado if you want to do some research. I think the department would be, their time would be better spent working on a regulatory structure that would implement the Compassionate Care Act that Assemblyman Gottfried and I have, so that, as you pointed out, you want to be in front of it, not behind it. You want to get there faster rather than later. Let's work on that process so when we do get the legislation passed and the governor signs it, you're already way ahead of the game in the implementation process.
Thank you, Senator. I mean, my goal is yours, to improve the health, protect the health and safety of New Yorkers, and offer options of proven therapeutic benefit. And because of the existing statute, that is the only mechanism I have today to advance the process. To the extent that safe, clean, unadulterated product is going to be, primary to making this product work, we're looking to the feds for the sources. To the extent that we're using a medical model with hospitals providing product, that's another way where we can, within the existing therapeutic relationship of the doctor and the patient, advance this model. The science is actually changing. 10 years ago versus today, there are many more drugs out there that help patients. In fact, when we first started down this pathway, we got a lot of feedback from ophthalmologists saying, absolutely not, don't allow medical marijuana for glaucoma. There are new treatments available that help, so please don't go down that pathway.
Dr. Shah, with all due respect, most of those drugs that are now available are highly addictive and dangerous. This is not about picking one drug over the other. This is about allowing doctors and patients to make the best decisions for themselves, depending on how they want to treat the condition that they have.
I agree.
Whether or not ophthalmologists want to utilize medical marijuana as opposed to an alternative drug should be a decision that they make. We don't need to take tools out of their toolbox, and we don't do that with any other drug. 2 minutes ago, you testified about restricting the use of off-label drugs. Well, there seems to be an inconsistency here. We don't have a lot of time, and I know a lot of my colleagues want to talk about the healthcare issues and the hospital closings in Brooklyn. I want to focus on this issue because I think your department is going down the wrong path, and in fact, in many respects, you're wasting your time. It is inconceivable that the federal government is going to give New York State a waiver to allow hospitals to dispense medical marijuana. It's inconceivable. It has not been done in any other state. In states that have a legal medical marijuana statute and a program up and running, the federal government has not given them any leeway. I cannot imagine a scenario where they would do that for New York. I am sure you are aware of and have a copy of the August 2013 memo from the Justice Department, which dictates the type of things you need to do in a state that has a medical marijuana statute to avoid the federal government coming in and raiding you. Everything that you've been asked to work on would subject us to a consistent rating process by the federal government. So what I would again emphasize is, take the time that you have. Ask your department to begin to develop regulations that will promulgate the Compassionate Care Act. So when we do pass it and the governor signs it, that process will be that much further down the road of getting a legal medical marijuana industry in this state. Because we've seen in other states, the regulatory process has been a stumbling block. There are patients who are suffering right here in New York. There are families with children who cannot wait for us to do this right. You said yourself that there's no way to get this Charlotte's Web strain that will help children with Dravet syndrome. And so those families are moving to
Except at
Colorado.
NYU.
Yeah, they're moving, no, because you see, you can't bring a product into New York State. That's also what the Justice Department has said, even if you bring it from a state that has a legal medical marijuana program. So unless we're growing it here in New York, which we can't, where are we going to get it from? So all I'm suggesting is, let's do this the right way. You work on the regulations on our bill, and then we'll get there much faster so that when we can start growing, we're able to provide real relief to patients. We cannot continue to lose people to other states. They're moving to Colorado. They're moving to New Mexico. They're moving to Washington State because they can't wait for New York anymore.
Thank you, Senator.